Good morning, Hank. It's Tuesday. So over the next 5 years, our families are donating $6.5 million to Partners in Health Sierra Leone. Also, we need your help, but more on that in a moment. When I was in Sierra Leone earlier this year, I spent a day with a community health worker named Ruth, who works for Partners in Health, making house calls to people living with serious illnesses like tuberculosis or HIV. Ruth makes sure her patients are able to take their medications and refers them to a clinic if they need further care, and also she can help identify high-risk pregnancies, which is critical in Sierra Leone because it has the highest maternal mortality rate in the world. 1 in 17 women in Sierra Leone will die in pregnancy or childbirth. 1 in 17. Like many people, Ruth's education was interrupted by the Sierra Leonean Civil War, which lasted from 1991 to 2002. During those years, she also contracted HIV, and she nearly died before access to antiretroviral therapy allowed her to recover her health, and in turn to find a job with PIH, where she can care for her family and serve her community. Today, Ruth is paid a living wage by Sierra Leonean standards, but she is far from well off. And at one point, Sarah and I were walking away to visit some other PIH employees when I happened to glance back and see Ruth slip the equivalent of $2 to one of her patients, a mother who was struggling to feed her kids a second meal that day. The family was also being enrolled in a nutritional support program run by PIH, but Ruth wanted to make sure that they could eat that day. And I want to be clear about this. It required far more sacrifice and compassion for Ruth to make that donation than it does for our family to make this one. But we're talking about our gift publicly today in the hopes of bringing attention to the many healthcare workers like Ruth who need to be supported by more robust systems in order to address the maternal and child mortality crises in Sierra Leone. And I do mean crises. This is an emergency. 10% of Sierra Leonean children do not live to see their 5th birthday, and 3,000 women in Sierra Leone will die in pregnancy or childbirth this year. They will die of hemorrhaging that any well-stocked hospital could easily address. They die because there is no electricity to keep the lights on during nighttime deliveries or to keep blood for transfusions refrigerated, or they die because there is no running water, which makes it difficult to sanitize tools and prevent infection. They die for want of medications or for want of surgical gloves. Or they will die because they need a C-section. And in Sierra Leone, needing a cesarean section is often a life-threatening emergency. A woman delivering at home or at a local clinic who needs a C-section will usually find that there is no ambulance to take her to the hospital, and so her best chance will be a long ride, dying on the back of a motorbike. This is an emergency, but because it is an emergency that has unfolded over many years, it doesn't receive much